Hi, Mr. Johnson. I want to ask you a few questions today. If you had to rate your life today at this moment, what score would you give on a scale of 1 to 10?
I think I would give it an 8.
All right, an 8. And what could we do to turn that 8 into a 9? What would you need for that?
This is Katja Sion. She and her team developed Connecting Conversations, a method to measure the quality of care in nursing homes. Connected Conversations uses interviews to gather data about the quality of care. Interviews are held with residents, care professionals, and family of the resident. These interviews can, for example, be used to establish what themes are most important to the quality of care. However, to gain insights, interviews have to be transcribed and analyzed. Currently, that is done by hand.
In the coming years, hundreds of interviews regarding the quality of care are expected to be conducted. It will be impossible to analyze these all by hand. Using manual analysis, these tasks can take weeks or even months.
Care organizations would prefer to have immediate feedback, so they're able to act upon that information. Luckily, we can automate a large part of that process using artificial intelligence. Using artificial intelligence, we can not only do it much quicker, but we can also analyze a lot more data.
Interview text can be analyzed in several ways. For example, we can use topic clustering to discover what the most important topics are in the interviews, but we can also use sentiment analysis to see, per interview, what percentage of text is positive, negative, or neutral.
Using topic clustering, we can analyze which topics occur most frequently in interviews.
This is done by first extracting keywords from a piece of text, then ordering them based on their semantics, and lastly grouping them together. Our results indicate that topics such as relationships, food, and life experiences are especially important. Using sentiment analysis, we can predict for each sentence in the interviews whether it is positive, neutral, or negative. We can also find out how people feel about certain topics and the quality of care in nursing homes in general.
Using artificial intelligence, we can quickly analyze large amounts of interview data. We can then use this data to provide care organizations with immediate feedback, and they can use this feedback to implement changes into the care they supply.